David Crone is Executive Director of the Cerebral Palsy Association of Manitoba. Good afternoon, David.
Good afternoon.
So tell me, what could a strike mean for your members?
Well, I would say a good chunk of my members do count on home care workers to come in to their home for their daily needs, whether that's getting up in the morning, food preparation, getting ready for work or whatever that it varies from person to person. So, this will be a big blow for their activity level, their self-worth, and just to get out into the community, get to their jobs. And so it really is worrying that it's got to this point.
What's the backup plan for a lot of your members who?
Well, so I mean, I know the Shared Health and the WHRA say that everybody has to have a backup plan, but so whether that's family or friends or whatever that might be, unfortunately, there are a smaller subset that don't have those natural supports out there. So they really do count on home care to be their primary caregiver. Some folks that are seniors, they might not have kids and family members that live in Winnipeg. They really count on this essential service.
If you're listening and your story, what David's talking about resonates with you, and that's maybe a challenge you might have, give us a call. Tell us about it. 204-780-0893. That's 204-780-0893. We, of course, also want to hear from healthcare support workers out there. If that's you, we want to hear your stories, what you're experiencing out there. 204-780-0893. We got this call earlier today on our listener line from Julie. Have a listen.
My household is also dependent on home care. These home care workers, I'm really worried that home care workers will not be able to get a decent contract with adequate pay and sufficiently good working conditions that we can continue to depend on them for the care that we need in our household. Being able to go on strike is an essential part of collective bargaining. And as these workers are preparing to go on strike, then clearly things have not gone well for them in the bargaining process. Workers are almost universally very reluctant to go on strike, and people who provide care or services to other people are among the least willing to go out on strike. They only do so in situations where they have no alternative because their contract is not adequate to support them or to protect them at work. We want our home care workers to have good working conditions and adequate pay so that we can continue to depend on their very excellent care. Thank you. Bye-bye.
Thank you for that call there, Julie. David, so I'm wondering, obviously she's impacted by this, but she also does empathize with the healthcare workers' perspective. How much, from your perspective, what do you think of, what the situation is for healthcare support workers?
I do know just through talking with my members that, just the recruitment of home care workers and the consistency of staffing has been a real problem. Just having, the same person that you've built trust over time with. But, I think you said that the starting wage was $17.07 for a home care worker. Well, the livable wage in Winnipeg is over $19 an hour. And how do you expect anybody to do that sort of work for that low pay? I think you could probably get the same type of pay at McDonald's or Tim Hortons or something like that. So, it really is like an allied health worker is an important part of the healthcare system. And the whole purpose of home care is to allow people to live in their home, to age in place. Those are all the things. And it's a lot cheaper to keep somebody at home with the proper supports that they need than putting them in a hospital bed or into a personal care home. Staffing has been a problem for quite a while. So I really do have, really want both sides to get to the table and come up with a livable package for both sides. It's important. Like you said there's 25,000 home care workers in Manitoba. That's a huge number. There's over 239,000 individuals with a disability in Manitoba. Not everybody needs home care, but a good portion of the population does, and our population is getting older, so that the demands on the system are getting more and more.
So if workers do go on strike, a reminder to listeners, so that includes things like healthcare aides, laundry workers, dietary aides, ward clerks, recreation coordinators, other healthcare support staff in hospitals and personal care homes, as well as home care workers are among those 25,000. So we want to hear from you. How worried are you about these healthcare support workers going on strike? You can call us 204-780-0893. That's 204-780-0893. So if if the workers do go on strike, or even that's avoided and they do get what they're asking for before October 8th, what difference do you think that could make for your members?
Well, I mean, I'm really praying that they come to an agreement so that there's stability within the home care and the allied health workers. I didn't realize that all those folks within the hospitals are also are part of that same collective agreement. So, it's a real, if you're trying to get people, to heal and to get people out of a hospital, you really need to have those support staff. Like if they're not doing it, what are you going to ask overworked nurses and doctors to do it? It's a ripple effect. Doctors have had increases, nurses had a good increase. It's time for the whole team at within the healthcare system to do it. It's about supporting people that need those services.
We've got Heather on the line. Good afternoon, Heather.
Good afternoon.
So what's on your mind when it comes to this potential strike?
Well, I was a healthcare aide, and what do I want to say? It is grueling work. It is work that will affect you even when you retire because it affects your body. I am surprised at how low the wage is. I just retired from a job that I was getting paid $23 an hour, and it wasn't as grueling as what the healthcare aides and support staff do, especially in nursing homes. That's what I have experience with. What I would like to know is how much does upper management get? I always find that big businesses, including the healthcare, they're top heavy, and they are not doing the grueling work that our healthcare workers are doing. And I would like to see something happen where they're not making as much, and our workers, our people who are doing all the grunt work, they are making more. Not more than upper management, but I'm saying more than what they're making, for sure.
Thanks for your perspective, Heather. Really, really appreciate it.
Okay, thanks.
We also have Allison on the line as well. Hi there, Allison. Oh, hi there, Allison. Well, it looks like we just lost you. If you're still listening, Allison, do feel free to give us a call back. We also do want to hear from you. If what Heather said resonates with you, if you're a worker or a retired worker, you want to share your opinions, or if you're going to be impacted by this potential strike, 204-780-0893. So I mean, you heard Heather there, David. I mean, she mentioned this grueling work. Can you describe for us, the type of tasks home care workers complete and how challenging that might be if a family member has to step in to replace a home care worker?
And it varies from person to person, but it might be doing lifts to get people up out of bed or throughout, on and off the toilet or whatever that is. Like, it's hard on your back. It's hard personal care wise. It's hard work. I mean, I wouldn't be doing it for $23 an hour. Right. And we do have to value people that have disabilities or are in healthcare, in the hospitals. And it's all about how we value them and the services that we need. And we really, I don't mind paying a bit more taxes to get the services that I need if the day comes that I need it. We're all going to be disabled at some point in our life, whether you're born with a disability, whether It's throughout like you're in a car accident, right? And you might need that support at home or towards the end of your life. We are all going to need those supports. So how does society support people that are in need? And the cheapest way of doing that is in the home, and having a good outcome that way.
Mm. When leading up to this, even like you said, that care has been inconsistent for a lot of your clients. So how does it impact a client if a home care worker is not available even for 1 or 2 days, let alone for a period of strike action?
Well, it's a safety thing. For some of my members, the only way they get out of bed in the morning is with a home care worker assisting them. They can't. So they're stuck lying in their bed all day, right? It 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 really is the dignity and the value on how what they're needed, and just having non-consistent staffing so that you're doing some very intimate personal work there. You need to get to know the person who's doing it, and everybody has to be moved a slightly different way. So there's some training that takes place. You can't just pop anybody in to do this work instantly, right? Like there's trust that has to be built up from both sides, understanding. A lot of my members have some difficulty in communication, so you got to learn how their patterns of speech are and their technology works. So yeah, I mean it's vital for all of us to be respected and having those services in the home.
We've got Mustafa on the line. Hi there, Mustafa.
Hi there.
Hi. What's on your mind? Is Tuesday a Tuesday strike looms?
Honestly, as somebody who closely knows the job of healthcare aid, when I first came to Canada, I started my healthcare career as healthcare aid myself. And I am currently working in home care as a nurse, and I furthered my education up to master's degree. So the workload, the amount of abuse those healthcare aides go through is totally ridiculous, and they definitely need a better work environment, better work condition, and fair wage. Like I believe Manitoba is the least wage scale compared to the rest of the country. So honestly, what they are asking is not out of reason. The government needs to negotiate with them and come up with a better solution so that the home care client will not suffer the consequence.
Thank you very much. How long were you a healthcare aide for there, Mustafa?
I did work as healthcare aide for a few years, and then I went back to nursing school. And so since then, I am in the business, so in the healthcare industry, working as in personal care home as charge nurse. Moved back to community, and since 2014, I am in home care right now, and I'm working side by side by so many noble, very disciplined healthcare aides that truly deserve a better treatment.
I know nursing is notorious, obviously, for its burnout rate as well these days. We've been reporting on that a lot too. How does it compare to healthcare aides in terms of workload, stress? I guess compensation obviously is better, but how does it compare to your work as a healthcare aide?
Manitoba is difficult when it comes to the workload. I have friends who work in Alberta, Vancouver, and everywhere else. And in terms of workload, still, even nursing is very heavy. And but it's not compared to healthcare aid. Healthcare aides, they have 10, 15, 20 clients in a day as home care. And on top of that, it is a physical job. They have to lift people, turn them, position them, give them a bath. It is physically demanding job. And so the amount of wage they are getting for what they do is not comparable.
Mustafa, thanks for joining us on Radio Noon this afternoon.
Thank you so much. Thank you for having me.
David, I mean, you heard Mustafa there. I mean, what do you think needs to change to make things better for both? Go ahead.
Yeah, no, Joe. So on top of the wages, and I really hope that union and the government can get together on that. The workload. Mustafa said it was between 20 and 30 clients a day. Well, you take that and divide it by a 7 hour shift. That doesn't give a lot of time for individual care, right? It's like run in, do the thing, and run out again. And you have to value the work that they do, and it has to be reasonable. And that's where if you pay more, you'll get more healthcare aides into the system, and then you can lessen the workload, because all you're doing is burning out people at this point. It just turns into a carousel.
So actually, Allison is back on the line here. Hi there, Allison.
Hello.
Hi. What's on your mind?
Okay. Anyways, I'm a healthcare aide, and I've worked with home care for 29 years, and I have just retired last week.
Congratulations.
Thank you. And I just have a few things to say. I think they do deserve more money for the co-workers, because even with the COVID, everybody was working really, really hard. And I also think that there should be more proper care for the clients as well. Like if there's a sick call, people aren't covering, and there's no family, and they're left on their own, like wet and everything in bed, and it's just not right.
How long were you a healthcare aide for?
I was a healthcare aide for about, I was doing cleaning and laundry and healthcare aide now for about 17 years.
Wow. And have things gotten better or worse since you started?
I thought they got really worse. That's actually one of the reasons I have retired. I thought things got really worse.
And, beyond wage, what would you like to see change to make life better for your former coworkers as of a week ago?
I think they should at least deserve, like for starting wage, I think even $21 for starting would be fair,
Mm-hmm. And in terms of working, do you think that would attract more people to the profession so it kind of shares the workload a little bit more?
I think so, yes. I should definitely think it would.
Okay. Allison, really appreciate your perspective today on Radio Noon.
Okay, thank you very much. Okay, have a good day. Bye-bye.
Yeah, bye-bye. And David, I'll leave you with the last word. I mean, just looking ahead in terms of just making life easier in general for your members, for healthcare aides. What do you like to see change on the whole? Beyond what's happening here with healthcare aides.
It's how people are valued, right? And we're not just a number on a sheet, a call sheet, or you need to take a few minutes to say hello to somebody, have a visit a little bit, like it's just common practice. That so if you can lessen, increase the number of healthcare workers and lessen the amount of people they need to see and their workload, I think it'll help across the board with mental health, with medical outcomes, and it's just, we need to be valued.
David, thank you so much for joining us this afternoon, and all the best.
Well, thank you for having me.
That is David Crone. He's Executive Director of the Cerebral Palsy Association of Manitoba.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.